This is Jackson. Say hi. Jackson, will you tell why he came in?
Yeah, sure. Jackson is 5 months old, and he was born breech, and so we had some hip problems. And when I was at the doctor, I told him about his head not rotating fully all the way to the left. And anyhow, they said he had Torticollis. Is that how you say that? Mm-hmm. We did physical therapy for probably 2.5 months, and I was frustrated with it. And so I talked to his pediatrician about not seeing much progress for a lot of effort, and she recommended that I come see Dr. Nathan. And I think this is my fourth maybe time? Fourth time. But I've seen just amazing results. He's holding his head level now. Before, he always slanted his head down to the left-hand side, but he's holding his head level. I've noticed just full range of motion. It's made a huge impact, and it seems like that Jackson's doing a lot better because of it.
And I think that if there's any parents that notice that your kid's head, after they're born, that the head is kind of wants to go to one side, that sometimes it can be real simple things like you just need to practice breastfeeding on both sides, and that can correct it. But there's other times when truly there's a misalignment in the spine, and that was the case here. And so we were able to adjust him once or twice, really, and the correction happened really quickly, and the progress was very, very quick. So it's not necessarily an ongoing thing where he's got to keep coming in, or the baby, if she has to keep coming in over and over and over, in a short period of time. And so at this point, seen him 4 times, and we're going to go to a month and just recheck him. And so along with physical therapy, this is going to allow the physical therapy to work much better because we got the alignment right in his upper neck.
Right.
So.
But I'll just say one other thing. We just had to go to the specialist because of the hip, but otherwise I don't really know that I would have known that he was favoring one side, except looking back, there was some signs that he always slept on the same part of his head. In the swing, he always held his head the same way. Breastfeeding, he could not do anything on the left-hand side. I was very frustrated and had no clue that it was a problem he was having. So those are some signs that you might just want to look for if you're feeling concerned, maybe.